Brownsville. I'm Michelle Jones, the city's epidemiologist, and I want to welcome you to BTX Cares Talks. And this is where we discuss important topics that affect our community. So as you know, the COVID-19 pandemic is not over, and we are seeing that increase in COVID-19 cases, especially when we've got the Delta variant in our community. So to provide us with some of the best information that we have out there, we have Michelle Aguilar from Valley Baptist Medical Center here in Brownsville, and she's the Chief Nursing Officer. So do you want to go ahead and tell us a little bit about yourself?
My name is Michelle Aguilar. I'm the Chief Nursing Officer at Valley Baptist Brownsville. Been there through this pandemic, so I'm happy to be here to provide you guys some information, anything that will help the whole community get through this.
All right, that's fantastic, and I want to welcome you for coming down.
Thank you.
So one thing that we want to kind of start off, I know you told us a little bit about yourself, but do you want to tell us a little bit about your hospital in case someone's not familiar?
So we are a 240-bed hospital. We are on Jefferson Street. We provide services to the entire community, anything from mother-baby care to open heart surgeries. We do have 2 ERs in Brownsville. So we're seeing a lot of the patients come through to our ER with COVID-like symptoms right now. So what we're seeing now is it's the Delta variant, right? In our ICUs, our length of stay is way longer than it has been before, and it is mainly in our COVID ICU. So right now we have 1 dedicated ICU, where before we had 2 for patients that were either coming for open heart surgery, that were coming for trauma, anything like that. And right now we have dedicated 1 specifically to our ICU to be able to provide the care to our community for those critical patients.
So one thing that, since COVID-19 has been around for a while, do you mind telling us a little bit about your experiences dealing with this pandemic?
So it's been something very different. Never thought we would go through this. I think none of us thought that we would go through this. But making sure that the nurses stayed strong, that the team stayed strong, that the patient, that the physician stayed strong for the community has been something very challenging. Every nurse has gone through something that, again, they've never gone through before. Stress of seeing family members, friends, members of their community pass younger than the usual. We're not used to seeing 32-year-olds healthy on an intubated, and unfortunately sometimes not making it through this pandemic.
And that's very sad because we always think about that younger generation as being more robust and healthy as we move forward. So now that we have the new variant, the Delta variant circulating throughout our community, how is your hospital working with the city, the county, and maybe some other entities to kind of help combat this disease? So I think
we've done a great job coming together from the hospitals in the county, the county itself, everyone to provide data. We want real-time data so that we know what our trends are looking like, so that we know where we have opportunities. Is it vaccination, sending patients for antibodies, for the monoclonal antibodies? Now, where are we now testing, where anyone can go and get tested if they have those symptoms? So we're working together to make sure that we accomplish one goal, right?
That's really great because it seems like a whole network has been developed to kind of help the citizens and the residents, like a giant community effort to move forward through this pandemic. So
I love that we all have been coming together and that we've been working so well in Cameron to, again, make sure that we stay safe, that we are spreading the word, that we're saying, please get vaccinated, that we provide that those opportunities for people to get vaccinated whenever they want, whenever they need it. So I do believe that we're working very well together.
So I did notice that you had mentioned vaccines, and we know that we do have good numbers when it comes to vaccinations, but we're not where we need to be. And there's a lot of people out there that are afraid to get vaccinated. Do you have any additional information that might help these individuals who are hesitant to go ahead and take that leap and get the stick?
Well, you know what, through my personal experience, I would say as we interview some of the patients, what I hear a lot, because we're seeing the younger population be sick, between 21 to 45, younger than 60 years old, and a couple 60 plus there. But what I hear a lot is, I thought I would wait one more day or put it off till tomorrow, and then they ended up sick. So if you're gonna do it, just do it now. Don't take another day to wait, because believe me, the variant isn't waiting for you to take the vaccine. So just do it as soon as possible. And then if there's other reasons why you're not taking it, that you are lacking education or you would like to know more about it, we have many various ways for you to get educated. Every hospital, I'm sure, is very, very happy to provide that education. CDC.gov, I know that you can go on there on the link and get all the information that you can, but we're here to provide that education to the entire community.
And that's real important to mention, because I know you said getting the vaccines readily available, so it's always good to know that your pharmacies have it. Oftentimes a primary care physician is going to have it. And then for those individuals who aren't aware of it, the city of Brownsville also has vaccine clinics. So we have a clinic at the Southmost Library that we do every Wednesday, and that's from 5 to 8. And on that one, it's 12 years and older, because we do have the Pfizer and the Moderna. If you are someone who wants to have a single dose, oftentimes we do have the Johnson & Johnson there. And I'd also like to let the residents in the community know that we also have them at the Farmers Market downtown at the Lanier Park. And those are every Saturday from 9 a.m. to 12 noon. And the same vaccines are available there. So it's real important that we get that information up and out there. So I also have another question for you before we kind of move on. Why don't we talk a little bit about like the importance of how that helps you in the hospitals if people are getting vaccinated?
So I'll tell you, it helps out. We've seen a couple of patients come in that got COVID with the vaccine, and that has been very, very few patients. But even their length of stay in the hospital compared to someone without a vaccine, they're actually coming out of the hospital, they're leaving the hospital. So even if you were to get infected with the variant, you don't get as sick. Maybe a little bit of a runny nose, that's what we're seeing, cough, some fever, but not being on a vent for sure. I will tell you, for us, it's been very different what we're seeing in the hospital when the people do have the vaccine. So I truly encourage this, because I think this is our only opportunity to make sure that we don't have an increase in deceased population here in our community. So that's what we're seeing, right? If you see someone with a vaccine versus someone without the vaccine, we're also seeing our patients as they come through with COVID-like symptoms, got the vaccine, they come out negative. Their tests are negatives, and they're coming out with other reasons to be in the hospital,
like a cold or a flu.
A cold or flu,
something,
something normal, right? But it's the only way is a vaccine or put on a mask, right? That's the only two ways I could tell you that we could see this get better.
Yeah, and we appreciate that, because working at the health department, that's what we're seeing with all of the data that we're having come out, is that the vaccinated individual, you might have to go home, take a Tylenol, maybe miss a couple days of work, but it's so much better than 20, 30, 40 days in an ICU. So we appreciate you also lining up with everything that we're seeing on our end. So with that being said, I just wanted to thank you, Michelle, for coming down and giving us the opportunity to discuss this important topic. And then before we close out, is there anything that we might have missed while we were having this conversation, or maybe that you feel we really need to drive home to our community to really put a stopper on this pandemic?
So I will tell you, thank you for giving me the opportunity for being here, because I get to speak on behalf of my nurses. I get to speak on behalf of our physicians, and I will tell you that we're here for you guys, and we're going to provide the care for you guys. The nurses are tired, the physicians are tired, and it is at some point mentally exhausting to see these patients be so sick. And we want to care for you, and we will care for you, but help us just a bit. If you do get vaccinated, if you do wear a mask, believe me, that makes everyone's life a lot easier. and it will keep us from going through these road bumps, from going through these strong emotions that we're having to deal with. And like I said, as a nurse, even seeing my nurses leave because it was too much for them is very difficult. And thankfully, we haven't had a lot of that. But when they do, it's difficult to know that someone will change a profession because of this hardship they've gone through.
Mm-hmm. Thank you so much. We appreciate that and all that you and your staff have done.
Thank you. Of course, I'll tell you, it is our pleasure. At the end of the day, this is something that we signed up for, and we are gladly to do it. We're gladly to do it because it's our community. Mm-hmm. We're serving our own people, our own family, our own neighbors. It's what we're here for.
Wonderful, wonderful. So we hope the community found this information informative, beneficial, and if you still need more information, please visit cdc.gov. And we also have that wonderful COVID hotline that you might have heard about in previous segments, and that's at 956-394-0012. For BTX Cares Talks, I'm Michelle Jones, the city's epidemiologist, and I want to remind everyone out there to stay safe and to stay sanitized.